Hi guys. We are actually going to start our live video, and welcome and happy 2018. Woo! We all made it another day. So we're going to wait a few minutes for Dr. Martin to join our live video. We're going to talk a little bit today about some food choices for detox and any questions that the ladies have. So we're going to give everybody a few minutes before we get started. And let's see if we can add some more ladies to the group. So we're going to wait a few minutes. Hello, Dr. Martin. We're going to wait until you get situated on the call so I can see you on the screen. Are you on the screen, Dr. Martin? Let's add you. How do we add you to the screen? How do we add you? So hello, guys. We're going to wait until everyone gets situated. Hello, everybody. We're waiting a few more minutes. Are you there?
I can hear you.
Fantastic. So we're going to talk today about detox and some foods that they can use to start doing that. We can give them a few minutes to sign and join up. I have some goodies in front of me that we'll talk about because we're really about reading a lot of labels because there's a lot of good choices that we have. But I'm going to show you guys some things when we start looking through ingredients. And pretty much I say this in my business doing hair as well, because I'm always seeming to have an answer for why I do what I do. And it's about reading labels and making sure that we're doing things in moderation. So today, ladies, it's 2018. So today is a new year for you to get out and change. And we can't change if we don't start today. So we're going to talk a little bit about detox and foods. And I know that I had posted a photo on the live thread. Dr. Martin, do you want to go over some of the foods, and maybe we can start at the top? I'm not sure what's at the top of that picture.
I don't think I have. Yeah, I don't have it.
Okay. So when we're talking about detox to all the ladies, do you want to clarify and agree with this, that a lot of the detox stuff that we're doing is going to be even harder until they explant? Do you agree with that? Dr. Martin? Can you hear me?
You're cutting out.
Now am I okay? Can you hear me now?
Now I can, yes.
Okay. Thanks, Lori, for joining us. So, Lori, thank you for coming, and Happy New Year's. Can you hear me, Laura? Lori, can you hear me? Lori Bush, can you hear us? If you could type in the comment section to yes. You can hear me, Dr. Martin, right?
Yes.
Okay. So, ladies, today we're going to talk a little bit about detox and some foods that you can start implementing. the question that I had asked earlier for Dr. Martin was a lot of ladies that are private messaging me about how I do the things that I do, and how I've maintained after my kidney was removed is I made sure that I was extremely, extremely detailed with my diet. With that being said, prior the explantation, it makes it much harder for our bodies to absorb anything. And I'm going to let Dr. Martin talk a little bit about that. I'm trying to explain to some of the ladies, Dr. Martin, that prior explant, there's only so much that they can be doing. They have been asking me about my infrared therapy that I have in my salon. And I actually had mentioned that's not a good idea until they explant, because that can actually push some of the silicone back. You want to go over a little bit about that?
Yeah. Trying to do much detox before you explant, I actually think is quite dangerous, because you're going to continue to break down those implants, and you're going to boost your immune system, which means your immune system is going to start attacking the poison that's in your body. And it's very counterproductive. It's going to cause more pain, more inflammation, because that's your body's natural response to the poison.
Right. And I know that a lot of them were asking me yesterday on one of our other groups about the capsule issue that we've been talking about for over the last year. If the capsule is not removed, I just don't even, can't wrap my head around that, why that's even happening. But for a lot of the ladies who are new to the group, and I have to say certain things on live videos, but the capsule, which is the bag, is pretty much most of the issue. So that has to come out. Do you want to clarify on that, Dr. Martin?
Well, the implant itself needs to come out, but our body makes a natural scar tissue, let's call it for kind of clarification term, that forms around it. It's like a blister pack that protects our heart, which is our natural immune system response. When we have a splinter, our body forms a pus pocket or a little blister around that splinter. The implants themselves are considered a splinter in our body. So there's going to be a blister pack that forms around that. We call it a scar capsule. What happens as the immune system starts breaking down and attacking that implant is the poison that's in the implant, the silicone itself, with all those, I think we have the list of the toxic ingredients that floats around everywhere. Look at that list, because then that's what breaks down and goes into your bloodstream and your blood and everything. If those scar capsules are broken, then that immediately uploads into your bloodstream and your vital organs, specifically your lungs right there, and your heart, because it's so close.
And then probably the kidney flushing all of that out, which I know well too.
Yeah. Yeah.
Right.
Well, your body's going to eliminate 4 different ways. It's going to use your kidneys to flush it out. It's going to use your colon or your gut to evacuate on that level. It's going to use your lungs to release the carbon dioxide from the poisoning, the off-gassing, and then it's going to come out your skin and your pores. A lot of women who've had a lot of the autoimmune stuff, they either have the bladder problems, they have the skin issues, or they're going to have gut issues. A few will have the lung, the asthma, the histamine reactions as well. But the kidney stuff is very common because your body's trying to flush out those poisons. And some of those poisons are, 1, carcinogenic, and 2, they're heavy metals. And they're very hard on our kidneys. They're very hard on our skin. Right. You know, and just at a cellular level, it damages the cell.
And that's what I keep talking to everyone about. And, you know, people sometimes will ask me how I've kind of come to the terms of figuring this all out. And I really have to say this, is that my whole lifestyle, I've been extremely healthy. Stunt work, holistic hair care, spin, Pilates, and I had no idea until after the kidney cancer that there was still something else going on, which is the reason for the TED Talk in the book. And I'm now going, oh my gosh, it's even to the fact where you posted something on the group about cockroaches, and I forget what that was, because I'm trying to explain to some people who still aren't understanding whether it's saline or silicone or beet juice. Beet juice is good for us, right? We could put beet juice in an implant. It's the capsule that's around the fluid that's inside that's causing us to have our CRP, which is our creatine reactive protein level. And if that's extremely high, it's inflammation, which is all we keep talking about. So of course, everyone's going to have bad hair. So going back to the point, a lot of ladies have asked me why I'm a breast implant advocate. I said, well, I lost my kidney and I found out my implants were leaking for 30 years. And my whole entire business mantra is hair health, hope, education with holistic products. So the whole reason today, what we're talking about with this detox is for most of us that have BII, and Dr. Talisman will say and agree with this, this is going to be a long-term repair, because our mitochondria, which we talk about a lot, is the main cell that helps cellular energy, right? At an even keel, sustainable energy. We call it the Krebs cycle. It's when our body kind of goes like this in waves, and we're always talking about energy. Well, once we have those implants, our energy now is like down here. So we have to do 24/7 things to kind of keep that kicking. So the photo that I posted about detox foods, Dr. Martin, do you want to go over some things? Because I know some of the ladies were saying this to me. Time. So I'm going to say this. My time is not replaceable, and especially since the cancer. So I want to make sure that I can get things to people and help them change things, because we all are trying to get healthy, right? But someone had messaged me and asked me how I find the time to go to Sedona and ride my bike, run a business, do my charity, and do all this food eating. I don't have a choice, because after the kidney cancer, I'm not going to get it again. And I found out that 90% of cancer genes that we already have are mutated by all of that other stuff. So one thing I want to talk about, and then I'm going to have Dr. Martin kind of go over, I actually found some good things for you guys that you don't have time to make food, and I get that. And I keep saying, why is healthy food so much more money than McDonald's? So last night I actually watched a movie called The Founder with Michael Keaton, and it was about McDonald's. And I had watched Super Size Me about 15 times, like 10 years ago, because I literally haven't had fast food since my renal cell carcinoma. When I cheat on things, which I do still cheat on my diet, my cheat is going to Sedona and having a bean burger on a piece of gluten-free bread with some avocado is usually my cheat. But it's the products that they're even putting in. So I found some companies, and we are actually going to make a list for all of you so you don't feel that we're vomiting information, but we're going to make a list of foods that you can purchase wherever you need to get them that we've already researched. So something like this, if you guys look at this bag, and we actually turn the bag around, and we want to read what's in the bag in the ingredients list, it's pretty much two things. It's cane sugar, apricots, and raisins. That's it. Big key is looking through the ingredients. And it's the same where I was telling ladies about beets. Me personally, I eat organic red beets. We have a little grower that we grow in our backyard at the salon outside. But this is another good brand of beets that you can get. And if you guys look and read all the ingredients in here, it lists everything straight here. You never want to buy anything that has sugar listed in the ingredient list on the front, right? So these are just some simple things that we can try and help you with. And this, I know for a fact, very good for detox for kidneys, pancreas, liver, all of that's being affected by the implants.
Beets and beets really help detox the liver as well.
So Dr. Martin, do you want to
Beets help to detox the liver as well. And they act as a binder for mold, so it'll pull out poison. Sorry.
Dr. Martin, you're saying the red beets would be similar to, say, I can't pronounce it, benetton clay? Because I know some ladies have asked me about the clay, and I'll probably have a video about that later because I'm on the fence with that. But they've been asking me about the clay to remove bacteria from their colon. Do you want to comment on that?
No, it's more along the lines of coconut charcoal. So if someone had food poisoning, that
Right.
type of thing, or you had, let's say you ate something, a banana. For me, I can't have bananas. So
Right.
if I have bananas because they're high in mold, I immediately eat beets right afterwards, or have a beet juice immediately because it'll slow my histamine down.
Okay.
And it'll help pull it out and eliminate it on out.
Okay, because a lot of the ladies were asking too, was specifically a lot of the ladies that do have mold and certain issues, say with nuts, things like that, were asking me how they could still be able to eat those certain foods and not have the reaction. I said everything is in moderation, and I know that I've implemented charcoal over the last couple of years. What's your thoughts on that, Dr. Martin?
Well, I am completely abstinent and will be probably for another year from gluten and dairy and nuts, and mold foods, oxalates. So, because I really want my gut to heal, I'm just putting it on vacation. I don't want to have to deal with the histamine reaction. I want my body to rebuild. I take my nutrients, I take my supplements. I'm repairing the cellular damage, and I'm going to give myself 2 years to do that. Then I'll try 1 or 2 little things back at a time, one thing at a time, and then see how I do and measure those results one thing at a time. Moderation is kind of a word that I'm not too sure we understand in our society anymore. I mean, describe what moderation is to me. That's what I'd like to know. Is it 1 glass of wine, or is it 4 glasses of wine? I mean, your moderation and mine might be two totally different words. So
Right.
I'd ask for a definition on their word, number 1. But number 2, I think it's really about giving your gut, your body, your bloodstream, your cells an opportunity to heal, to go on vacation. And you know, it's uncomfortable to not have gluten. It's uncomfortable to not have dairy, but it's worse if I do.
Right.
So I'm easy. I'm easy. I don't need the pain. I don't need the swelling. I don't need my skin all broke out. You know, I'm perfectly fine and happy, and I'll eat celery or whatever it takes, you know, to not hurt. I'm willing to put in the work to not hurt.
And I know in the last few months with the groups, a lot of the ladies will ask me things like this: what do I eat? So going back a little while ago, my parents live in Amish country, which is called Lancaster. They're very, very, very simple, conservative people. They've been married 53 years. They grow their own food. They don't have microwaves. They don't like the computer. My dad still has a flip phone. So we were talking even more about 5G and electric magnetic energy fields. And my parents, who are now in their 80s, keep asking me, what happened since you moved to Hollywood? And I said, well, Dad, silicone, 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 and a million other things. But on that note, when I went completely macrobiotic, and I'm not going to lie to any one of you guys, it sucked. I mean, for 3 weeks, I can't do this. Like literally, I was like, what am I going to eat? Now I'm to the fact, really, I'm down to about 10 foods, and that's all that I eat. And I make sure that I stick very strictly with my diet, and I feel fantastic. Now, when there's some things that we're talking about with the dairy, and let's say Dr. Martin can't have the bananas, which has potassium, and then someone else can't have nuts, which is our selenium and our zinc. I'm going to tell you this as a hair expert. 3 big things are lacking, and this is with implants and without, is calcium, magnesium, and zinc. So when I was talking about food choices, Dr. Martin, are you allowed to eat these? Can you have, can you eat these? Dr. Martin?
What is it?
These are skinless, boneless smoked sardines, which I can't
Yes.
stand. I'm eating them now because I also can't have a lot of nuts. And we know Brazil
Yes.
nuts. So I had to
Yep.
find a happy medium. And I'm not going to tell you I like it. Ugh. I just mix them up and I do this. But we have to kind of make a list. And I tell the ladies, because I've had SIBO for 2 years and it was horrible, I never want to have that back. So I'm going to probably start eating these.
Yeah. Yeah. When I had cancer, Tammy, I lived on 5 foods for 5 months. Five foods. Olives, onions, garlic, spinach, kale. That's all I ate every meal. And occasionally a treat was an egg.
My gosh. And that's what we're talking about. That's what we're trying to talk about with the group. There's so much stuff on the internet. And I at some point, we need to start a website like my chemist, Webaloni. I really think we should do that. But can we get back to the whole detox foods? And can you go over a little bit? Because the whole problem is that people want one thing and they want it to fix everything. And they spend so much money on whatever. And I know people are at a spot in their life where they're like, how do we keep doing this? And we keep spending more money. Well, we're giving you free resources to things that we've done personally that have worked. And we're trying to help people with the proper food, because if we're not feeding our body, none of this other stuff is going to even matter. So can you kind of tap on a little bit about detox foods for kidney, liver, and pancreas?
I can give you a rough draft off the top of my head of foods that I have found that do not cause a histamine reaction.
Perfect.
For people that have mold issues.
Perfect.
Now, I'm a blood type O, so at this point in my life, I do have a little bit of meat. I'll have salmon or tuna. Those are my favorites. But I have a lot of celery still. I have a lot of kale still. I do eat a little bit of carrots just for the flavor. I have a lot of broccoli and cauliflower. I eat it almost every day. I really like celery as a detox herb and vegetable. I also like limes. Not so much lemons. I haven't been able to tolerate them for some reason, and I'm not sure why. But limes I do better with. I like beets, but I don't do them very much because they have a lot of sugar in them for me. And I went to that point where my sugar level went real high. So I pulled that back. And that's why I don't have a lot of carrots either, because they're both really high in sugars and glucose. So I kind of stick with anything green. If it's in the green section of the produce, then I'll buy it.
Right.
You know, I like color too. I like purple potatoes. I like purple carrots, but it's just a treat thing. It's just a 1 or 2 little things that make it different. But I eat about any kind of olive I can. I eat a lot of red onions because they're so detoxifying. And I eat a lot of garlic because it's so detoxifying. As far as herbs will go, I eat a lot of rosemary because of the effects for my circulation, and it helps with the joint pain. Also, cilantro will help pull out the heavy metals. And parsley as well helps to purify the kidneys, you know, helps to kind of keep that urine and uric acid levels down. I know I'm forgetting something, but that's kind of where I stopped in my brain.
I do know that what I was going to say to one of the ladies yesterday, because I really understand that sometimes as we're talking, it's harder for them because they're not in, you know, no one's in the same situation. And I would say even prior to cancer, I was still like this, but I'm even more so now. And I'm going to say this, and I'm only going to say this one time. Starbucks is not your friend. And I'm going to bring up this only because of my biochemist who used to actually be the chief science officer for Univera, which is a company I don't talk about much on Facebook. But he wrote a book called Caffeine Blues, and then he wrote another book. And I didn't realize any of this, and I'm going to tell you the facts because I had Addison's disease, I had adrenal failure, and I had renal cell carcinoma. I taught spin 6 days a week at 1,800 calories a class. My adrenals were tapped out. I thought drinking coffee, I don't even know why, because it's silly now. But now I'm cutting back all of my coffee because of two things. Because it's adrenal crash and there's a ton of mold on there. And
Yes.
I had no idea until I went to Costa Rica. I went to Liberia, which is a very small place in Costa Rica, because I was looking for help for my cancer, because out there they do a lot of healing, cleansing foods, believe it or not, okay? And the guy took me on this tour in this coffee plant, and I was like, how comes the coffee beans look bitter here? And he goes, it's because of the soil that we grow our beans in. 90% of American coffee is moldy, so I'm sorry. That's something I had to talk about for ladies. I cut out the coffee and I replace it with maca. I don't know how to say it because I still have brain fog. M-A-C-H-A, Dr. Martin, do you know what I'm talking about? It's a tea.
M-A-C-A.
Yeah.
Maca. Mm-hmm.
I'm not saying it tastes.
And that helps your hormone levels too.
Yes. So I know
it'll help you not accumulate fat.
I know that caffeine has been a big thing. And kind of with that being said too, ladies, as we talk about this, we spend our time where we feel it's important. And we spend our money where we want to, where we feel that that's something that we're going to get. So maybe if we just cut Starbucks out and replace that with a couple other things, then it will start helping repair some of that other issues that's going on.
My favorite thing when I got off the coffee was Fiji water. Get about the 12-ounce bottle of Fiji water, take a couple gulps out of it, and then pour in an unsweetened cranberry juice, and it flushes the liver. It's actually in Ann Gettleman's book on a liver or a fat flush. Awesome. And you can drink it a couple times. You can have it maybe in the morning and then maybe early in the afternoon, but it's going to work quite a while, and you're going to go to the bathroom a lot, eliminate a lot. It brings down the inflammation a lot. But that's my new go-to drink. I love that.
What is it again? You said cranberry and water?
Cranberry and Fiji water. It helps to eliminate the silicone. It also helps to flush out the fat and the fatty tumors that we've accumulated in our liver, because our liver gets sluggish from the heavy metals. Right. And so that's going to cause gallbladder issues. You don't want to lose your gallbladder. You lose your gallbladder, that's going to increase your chances of cancer over 50%. So, you want to really work on that liver detox. And I really think it's a simple thing that you can do. Fiji water and unsweetened cranberry juice, just an ounce or so every day, twice a day, no big deal. Cheaper.
What's your go-to on, because of the issue before with SIBO and fermented, and I can't think of what I'm trying to say. Can you give us some foods for the pancreas? Like specific foods besides what I've been on right now, which is my apricots, because I know these are good for our pancreas, to keep the pancreas moving so that the insulin and all that keeps kind of working in sync. Because I know personally a lot of the ladies that I've spoken to that have had organs removed, we're now at the point where we're almost diabetic, and it's not from eating sugar. It's because our pancreas isn't making the right stuff to keep that kidney
Yeah,
going? Do you have, what do you
insulin
recommend?
resistant. The insulin resistant, well, cinnamon really helps. Cinnamon. I put a little bit of cinnamon on quite a few different things, and I like pumpkin, organic pumpkin, and I like just putting cinnamon in that, and I can handle a little nutmeg, but I'm really allergic to the cloves, so I can't have the cloves, but just a little cinnamon and a little nutmeg and pumpkin, and sometimes I bake it, and sometimes I'll just put it in a shake or something, with some coconut milk. That's enough.
So how would we go about getting a list or some questions? Because I don't think, let me rephrase that. I think a big percent of the ladies have no idea if they have mold or not, except for like Deanna and I and you talking about things. Most of these people don't know where or how or what kind of testing. Is there specific tests they can do for that?
Well, a couple of things you can do is just an allergy test.
Okay.
And just an IgG or an IgE blood draw with your immunologist or your primary care, and just do a mold panel. Most insurance will cover that. And if any of those molds pop up, you can pretty much bet you've been exposed. But the other thing, I don't really like to expose people. I call them the scratch and sniff test, where they scratch on your back and see if you're having a reaction. You can pretty much do those on your own if you want, but they're kind of painful. And, I'm not, I like being nice to people.
So I think that would be a big thing, is for the ladies to get a definite allergy test, but they're going to be testing high while the implants are still in there. But this will give them a guide of the foods, because 90%, and I say this over and over and over, the foods that you're craving are the foods that you shouldn't be eating. And I know this only because I lost my kidney. When I start craving potatoes or potato chips or whatever, I know that I shouldn't be having those foods. But I keep trying to explain. I would almost guess 90% of us are eating the wrong foods.
Yeah. Yeah. It's like being an addict. Yeah. It's like being an addict. We crave the worst things for ourselves. And on some level, I think there is a neurotransmitter up there that goes backwards. And instead of telling us this is a danger food, you have to say, okay, I'm craving the potato chips. What's a better choice for me? And if it's the magnesium in the potato chips that you're craving, identify what is the mineral. Usually it's a mineral, sometimes a vitamin that you're craving to replace something that you just got depleted on. And that's how we get our cravings. We crave sugar because we're depleted in our salts and our minerals.
Right.
So, the opposite thing is usually what you have to kind of look at. I crave a lot of potatoes, and I've had to do some testing to make sure I can handle those. I also am very depleted in my magnesium, and potatoes are very high in magnesium. So you have to kind of negotiate with yourself. I don't have the fats. I don't have it breaded. It's not gluten. There's some boundaries there around that.
And I know
the other food I like a lot is cranberries. Cranberry is like a treat to me. So I'll have I have cranberries in my water. I have cranberries just in a bowl. That really helps with your insulin. The apricots, dry them, eat them whole. They're about as wonderful as peaches is for people who have histamine issues. Instead of taking antihistamine, just eat your peaches.
And I know we're talking about, after this month, we're going to start having some workshops at the Wellness Salon, because we want to try and bring a lot of the Arizona ladies together. Because I'll tell you this, for the last decade, 10 years, I've been married, but I've kind of conquered this journey alone, and I've had to figure out how to come up with facts, because my husband is a DPM, which is a doctor of podiatry medicine, and he doesn't have any health issues. And unless you do, sometimes it's really hard to understand what we're going through. So we're hoping that these workshops will give more information. We're going to do some cooking classes and try and teach everybody how they can do things simple, because I'm going to tell you the truth. When I get in my car and I drive to Sedona 3 hours to go ride my bike for an hour, I don't have a whole lot of time because I'm a single business owner, right? But I managed to pack up my food 2 days before, and it takes me like 15 minutes. And I have food when I'm there for 4 or 5 hours, so I don't even have to feel the need to go out. Getting back on the detox foods, Dr. Martin, can you talk about some things for, we were talking about inflammation foods last Friday, but can you just spout off a list? I think there's about 7 or 8 of them on that photo of inflammation foods we should not obviously be ingesting.
Sugar.
You know that.
Dairy, gluten, those are big inflammation. Anything that's grown with a GMO in it, Monsanto products, they have antibiotics spliced into the molecules and into the cells. And those most people do have allergic reactions to or inflammation from. Especially if you've had immune issues already, say you've had cancer or you have breast implants or you have diabetes or you have thyroid problems, you're just not going to handle those things well. Right. Inflammation foods for me, I absolutely have to stay away from anything that is a neurotoxin. So for me, it's fluoride, it's carrageenan. Carrageenan is used as a thickener in our yogurt.
In everything.
I was a big yogurt girl. Right. And so I got rid of fluoride and carrageenan. The lights kind of came back on.
Right.
They were big, big foods for me. And then I also react really strongly to MSG.
Yeah, Chinese.
And MSG has about 50 different definitions or words that they use to define it. It's one of those things that kind of flabbergasts me at times with understanding what is MSG on this label, because they disguise it.
Right.
So do some research on that. Parabens, anything with a preservative in it, I can't handle that. My little mast cells, my cellular level stuff is like, we've had enough. You had cancer, you had breast implants 35 years. That's enough torture. We're just ultra sensitive. And I figure if I can figure it out for myself, then I can help to share it for other women, because there are thousands of women out there that are coming up that are very sensitive to things that 20 years ago they never would have thought of.
Right, which makes a fact that we can say something has changed in the food quality and the way the medical community is doing things. Because my parents, who live in Lancaster, PA, it's Amish country, are in their 80s, and the only things that's wrong with them is they're bored and they have to go plow snow, you know? And even going back in the day when we would have milk delivered to our house, because the cows back then weren't injected with all this antibiotics, and our grass was grown without, nobody where my parents lived used DEETs. They use apple cider vinegar to kill their weeds. And it's just crazy, you know?
Yeah, or neem oil or something organic, yeah. Yeah, I know.
Michelle or Lori, do either of you ladies have any questions for us, myself or Dr. Martin, while you're on this call? Michelle and Lori, do you have any questions for us? I think I can add them. I'm going to try and add them. I'm seeing if I could add you ladies on camera if you want to ask some questions, or you don't have to. Did it work? Oh, it's saying I can't bring anyone on. Hi, Kimberly. Happy New Year. Kimberly just joined us, Dr. Martin, and my cat is antsy. Hi, Kimberly. We've been talking about detox and healing foods for the pancreas, liver, GI. Would you like to ask Dr. Martin anything while we're on this live call? Kimberly? Kimberly, can you hear us? Dr. Martin, I'm not sure that they can be added on live video. Would you like to cover anything else regarding food and detox once they have all explanted? And as far as the mold sensitivity issues, we can give them a list of a test, which is a basic allergy panel, correct?
Yeah, I mean that's the cheapest, most viable way to rule it out right away. But there are more tests available if any of those come back. It's just a lot of the old general practitioners would run that to see what your sensitivity level is to mold to begin with. And so once you figure that out, you have a pretty good indicator of some complications. And then you need to know if it was an external exposure or an internal exposure.
And then going back to the part about, we were talking again about the pancreas and how we're trying to increase the function through the kidney. And we were talking about beets. What other foods were you talking about? Celery, I know for sure, is antiviral.
Well, and then the spice that I like is cinnamon.
Okay.
And I don't see anything wrong with the pumpkin. It's not high in glucose. It is more of a complex carb, but so it's going to digest slower. And I would dare say if you added some kind of an oil, like a coconut oil to it, you could slow that down even slower.
Okay. And then I know we were talking a lot about this too. Over the last decade, I've heard more stories about the oils, so to speak. So, and I know we're on the same page as this. There's only one or two types of oil that really should be even used moving forward, which is I can't pronounce it, EVVG, coconut oil, and I think the other one is sapphire. Can you confirm that for me, Dr. Martin?
I pretty much live on coconut oil, coconut milk, coconut charcoal, coconut capsules, coconut butter, coconut milk. I mean, coconut's my friend. So far it likes me. It better never not like me because I'm going to be in real big problems then. But I occasionally do use a little bit of extra virgin olive oil that's unfiltered.
Okay.
I like really pure, high-grade organic stuff. Down there in Arizona, you have a really good olive vineyard or olive orchard. I'm not sure how you would say that, down there in Queens Creek. And I love their olive oil down there. It's very nice, very nice.
Completely different. You can tell by the way you look at it, the color is completely different.
Yes, yes. And just we don't do a lot of cooking, just low heat, very fast, little sauteing, things like that. But mostly coconut oil is where we're going. Again, a very high grade, low heats, sauteing. My husband does still like bacon, though.
I love that bacon grease for my recipes. Ah!
Yeah, well, he is a very big paleo kind of guy, so he loves that.
Yay!
Natural fats. Yeah, so he loves that.
So that really helps, and that your husband supports you with the diet, because I know a lot of the ladies were telling me, and Deanna had mentioned how hard it is because she has to eat differently. And I said, it's kind of the same in my household. Like my husband and I, we don't eat dinner together because his diet is nothing like mine. He's healthy, but he doesn't have to read things like I do. So it's awesome that you have a partner that helps you out with all of that. And I was telling here,
well, if the truth were known, he's the one who wants to eat healthy. I'm the one who just loves everything. I have the same birthday as Julia Childs. So I just love food. I love tasting everything. I want to stick my finger in it and try it and smell it. And, you know, I just love food. I just love it, love it, love it. It's a big passion of mine. But Greg is a lot more sensible. He's a little more practical. He understands health probably better than I do after everything we've been through. And he's been telling me for a couple of years now, you need to be just paleo, give up all grains, no grains, you know, and I think he's right. I mean, I really do, based on, you know, all that he has read in the libraries, and then just my physical reactions. I have constant reactions. And I think the little rice that I do have now, I'm developing a reaction to it, but I don't have it that much. And then if I start to get an itch or anything, which I really haven't had any of that until about 2 days ago. We ate out at a different restaurant, and I had a little bit of itch on the back of my hand. And so I took double doses of my ASEA, and it went away in like 10, 15 minutes. So I didn't have that tool 2 years ago, you know. So I really suffered. I suffered heavy. Nobody wants to go through all those blisters and lumps and
Kimberly, can you hear us on there? Kimberly, would you like to ask any questions and type in the box for us while we're here on this live video? Anyone? And I know while we're waiting, Dr. Martin, Michelle has been a very big advocate with her oils. Do you want to mention or talk about anything regarding that? Because sometimes we will implement them internally as well as externally.
I haven't been using a lot of oils lately because of my nose is just so sensitive to everything. You know, I just get triggered so easily. I don't wear perfumes much or deodorants much. You know, I kind of avoid people because of it. But I did make up my own perfume this year out of an amber resin, and then I was able to kind of find a little recipe, and so that was just something fun that I did this year for myself. But it was an essential oil that we found quite a few years ago that I loved, and I had wanted to do this project, and I was finally able to do that before the holidays, so that was fun. But I just don't do a lot of fragrance on any level, not just essential oils, but smells, anything. And I hope I don't stay like this, you know. I think it'll pass. I think it's just a part of the healing process, but that's just where it is today.
Because I know that in in my salon, I know I do use, I can't remember, Michelle, if it's called Thieves. I think it's called Thieves. And I know that helps to detox my air. And I know because I'm so strong with my pets are gluten-free, soy-free, dairy-free, macrobiotic. Their food costs a lot of money, and I make the food with the company's called Raw. They're one of my friends based out of Portland.
Oh, yeah.
Yeah. I forget what I was going to say. Sorry, brain fog. But I do love that Thieves oil because I noticed that I've been using it at the house and the salon, and the pets are more mellowing down. So there's so many.
They're wonderful oils. Wonderful.
So I keep telling the ladies, there's a lot of things that we can do to help detox. We just have to make sure that we have our facts first. And I talk about this more than anything because let's just say you're allergic to, say, garlic. I live on garlic because it's a natural antibiotic. It releases acetylcholine, and a lot of times I'll just chew it. If I ever feel like my ear's weird, I just chew on that, and it's gone like that. However, when I had SIBO, that just put me in a horrible place. So if we can get the tests and find out first if we're allergic to certain things. Most of you guys are probably going to be allergic to ragweed, dandelion, and I think it's bird feathers. Those are like the 3 things. But with that being said, not a lot of things have those ingredients in them. Do you want to comment on that, Dr. Martin?
No, I think you covered that very well.
Woo! We have Dana Brown that joined us. Did you see? And I know Dana Brown, you're new to the Arizona group. Is that correct? Can you type in the browser if you can hear me? I think Dana just came on board to the group, Dr. Martin. Do any of the ladies have any comments that you want to say in the comment section to ask before we close our video? Comments? Dana, do you have any comments for us? Questions? Information? How about, can everyone post in the comment section what you had to eat today? And did you go outside and hike or ride a bike or take a stroll around town? Can we all do that? Everyone, what have you eaten today? And what have you done to start your workout program for 2018? We're about ready to wrap up this video on detox, healing foods after breast implant illness. Martin and I survived both. What's going on there? What's the noise?
My baby. He hears people in the hallway and he thinks he has to protect his mommy.
Is that your husband or your pet?
My baby. Our little Zeus.
Oh, cute.
He's actually our service dog. I got him before my explant because I fell all the time. I was dizzy all the time. And they thought it was just seizures. And so he always knew when I was going to fall by getting my attention. And that's kind of how we found out that he was kind of gifted. And so I would just kind of distracted and pay attention to him and sit down and hold him or something. And then several times I noticed that instead of just sitting down, I kind of fell down into the chair. And so I had some conversations with the doctors and they said, well, I think he's alerting you that you're getting ready to have a seizure. And so then we started paying attention and then actually got him trained. So yeah,
I can't wait till you.
He's very, very protective of us.
I can't wait till you get to Arizona. They can be friends. Because Michi, have you seen Michi on any of my feeds? Michi is she's a therapy dog only because I tried to have her tested to be a diabetic dog since my husband deals with diabetic patients and pain neuropathy. And when I had the cancer, she would keep pawing at my right side and would lay by me. Long story short, I don't know that I would have pushed to going to the doctor if the dog didn't keep doing that, but I know that our animals are very intelligent and very smart human beings, and I can't wait for you to get to Arizona. But we're going to wrap up this video, and I want to kind of just go over a couple more things for everyone who missed the first part. We were talking about some foods if you don't have a whole lot of time. There's some healthy options out there. You just have to read all the labels. These are very good. Is it backwards?
Yes.
It's backwards?
Yep.
Okay, I don't know how to fix that because I'm almost 50 with brain fog. I don't know how to work technology. But these are good. They're chewy apricot raisins. We were talking earlier before about beets. Beets help kidney, pancreas. This is very good. Liver, pancreas. We're talking about a lot of mold issues, and we can't eat a lot of nuts. For those of you guys that have serious mold issues, nuts are really important. Brazilian and sunflower, because they have selenium and zinc, and we need that or our hair starts to go to crap. So I've been starting to eat this, and I don't like it. It's seaweed. It's gross, but this gives me my zinc and my selenium. I really don't like this, but it's a good option. We're talking about sardines. These are organic sardines for your zinc, magnesium, and calcium. And we were talking about detoxing away from caffeine and coffee because not only is it bad for our adrenals and causes Addison's disease, renal failure, and a million other things. But the beans have mold. So that's what we're talking a lot about, is getting tested for your allergies, see if you have any mold issues. We're going to start changing the way we eat, the way we think. We'll be able to have our health back, and the boobs are going to be gone. That's what we're talking about. So Dr. Martin, would you like to add anything to 2018 today?
Happy New Year. Happy New Year.
Happy New Year, everybody. And ladies, thanks for joining us. And I'm so grateful for the Arizona group. You guys are awesome. We're a great support system. Thank you to Dr. Martin for all she does. And her little admins, Joan and Melissa, have been awesome. We appreciate all of you guys, and get out there and do something. Bye. Bye.
Bye-bye.